Good afternoon, Dr. Kwame. My name is Shelby Pesic, and my evaluation was done on the program HUD-VASH and the three factors that are affecting its efficiency. So the purpose for this program was to evaluate, or the purpose of this study was to evaluate the program of HUD-VASH and find factors that inhibit the efficiency of HUD-VASH and focus on eliminating those factors. The thesis that was produced came from, or was produced by three factors that are inhibiting the efficiency of HUD-VASH. And so it was the aim of this paper aims to explain that in order to improve the efficiency and effectiveness of HUD-VASH, researchers and administrators must find and focus on sobriety, better case management, and reduce the time to placement for participants of HUD-VASH. The program of HUD-VASH started in 1992. It combined HUD, which was the Department of Housing and Urban Development, along with the VA, the Veterans Association, and it combined both those services. So the HUD and the VA combined to HUD-VASH, combined the long-term case management and clinical services with permanent housing support for homeless veterans. In 2009, former President Obama issued a nationwide strategy to prevent and end homelessness by 2015. This came in the form of a plan known as Opening Doors. Opening Doors was the first comprehensive federal strategy to prevent and end homelessness. So from this call, the strategic plan in place by Obama required HUD-VASH to step up their services. It dramatically increased, which means that an evaluation of the program needed to be done to see if it was being as efficient as it could be. So the literature reviewed or found, let me tap this really quick so we can focus. The literature review found that three factors that kept appearing that were inhibiting the efficiency of HUD-VASH. One of them was sobriety. A lot of articles spoke about housing first approach. The housing first approach is where an individual can come as they are, addicted to drugs, addicted to alcohol, and still be placed in supportive housing. These articles showed that the housing first approach really did work. However, these studies showed over only a 12-month period that they were effective in retaining housing. So that was a couple of the articles that I came into contact with. Another was a case study that revealed factors of time to placement and benefits of better case management. So there was a study done on group case management and the effectiveness that it had with participants. And also because the HUD-VASH program participants are increasing, case managers' client load and caseload are getting heavy, and so in order to make that more efficient, this study goes on to prove that group work within the clients that the case manager sees, it actually helps the group members deal with their sobriety issues and other issues coming out of homelessness, coming back from war, that those are really actually beneficial, and at the same time it allows the case manager to see multiple clients in one setting. Another factor that was shown was time to placement. A study showed that the longest process in the HUD-VASH system was intake to referral. And it also showed that better case management correlated with the client's longer stay in the program. So proving that with better case management and getting someone into housing, a homeless person into housing faster, actually allows them to retain housing longer. Also, in addition to this, what I found throughout the literature review was that most studies were done from a 12 to 24 month period, and it revealed, and another case study revealed that over 20 years, more problems and more factors begin to show themselves. A lot of recommendations from literature were to do longer studies with these factors. So the theories that were used in this evaluation were efficiency assessment and impact or outcome evaluation. Efficiency assessment helps to identify ways in which HUD-VASH is cost effective in regards to the services that they do offer homeless veterans. And the impact evaluation is to see if the program produces its intended improvements in the social conditions that it does address. These theories are suggested for programs that are stable and mature and that have been around to be able to produce a lot of data, and HUD-VASH has been in existence since 1992, which makes it a great program to evaluate based on these theories. So the methodology for this approach focuses in on 3 factors, which is sobriety, time to placement, and better case management. All the studies are done with treatment as usual under HUD-VASH. And then all 3 factors will be tested from recommendations from previous literature. So with sobriety, the way the study will be conducted is with the Mission Vet program will be combined with HUD-VASH to see if this can help with the factor of sobriety. Time to placement will deal with the housing first approach to see if it improves time to placement. Since housing first improves time to placement by 5 months, the difference in this, of course, is the TAU will be the normal HUD-VASH system, or the normal HUD-VASH system over compared to 12 months compared to a longer time period. For better case management, there will be a TAU group of HUD-VASH, and then case management in HUD-VASH with an emphasis on group settings within HUD-VASH to see if better efficiency and effectiveness was approached in that. The data will be collected from will be collected in 3 segments. It'll be collected over a 2-year period, a 5-year period, and a 10-year period. And participants will be chosen from SAHA, which is the San Antonio Housing Authority. And participants will already be in the HUD-VASH system, just in the San Antonio area. So based on the results through the 3 studies that will be conducted, will show if the recommendations given by literature actually benefit or make the program of HUD-VASH more effective, thus making it more efficient. So we're testing recommendations already given by literature to go ahead and give the literature a thumbs up, it worked, or a thumbs down, it didn't, and go ahead and do away with that literature to promote further research in the future. Recommendations for the stakeholders, for future administrators in the HUD-VASH system would be to invest in research, research for homeless populations because they're constantly changing along with the culture, to invest in longer studies, more than 12 to 24 months, because the data will change, factors will change, and so it's very important that future evaluators look to see the differences in that. In conclusion, I think stakeholders should feel confident in this program and the steps that it is taking to make veteran homelessness non-existent. Improvements can be made in the areas of sobriety, time to placement, and better case management in order to improve upon the effectiveness and efficiency of HUD-VASH. Like I said, more factors can be found through this with further research and an investment in research into longer studies over these 3 factors, and whatever the data concludes, maybe finding more factors that inhibit this program. And that is my evaluation on the HUD-VASH program, and thank you for your time.